John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 90 countries around the world with the news that people affected by MS need to know. I'm also a non-scientist member of the International Progressive MS Alliance Scientific Steering Committee. I'm a district activist leader for the National MS Society, and I also chair the Society's California Government Relations Advisory Committee. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm thrilled to be with you today, and I see that people are continuing to join our webcast, so let's give them another few seconds and then we will get started. I want to thank all of you who are joining us on GoToWebinar, Facebook Live, and YouTube Live. The MS Society's Ask an MS Expert webcast is designed to connect you with the MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. So as I chat with our expert today, please feel free to post your questions on Facebook and YouTube Live, or type them into the question box if you're joining us on GoToWebinar. We'll try to answer as many of your questions as we can during the Q&A portion of today's program. Taking steps to improve your health is an important aspect of managing MS, but changing health behaviors is hard. And changing health behaviors while managing a chronic condition like multiple sclerosis can feel overwhelming and maybe even seem impossible. Taking charge of your health can be a lot easier when you have someone to support you every step of the way. Today, we're talking with nutritionist, advisor, health and wellness coach, Kate Costello of Wildcrafted Wellness in Washington, D.C. Welcome, Kate. Last month, I saw you featured in the MS Society's Momentum magazine, and I remember reading in that article that wellness coaches can help people with MS get on the right track. So I'm looking forward to taking a deeper dive into that topic today. And I thought you could get us started by explaining what exactly a wellness coach is, whether there's a difference between a wellness coach and a health coach, and how a wellness coach might help someone living with MS.
Hi, John, and hi, everyone. Thank you so much for having me today. I'm so excited to share more about health coaching and just how supportive and transformational it can be. And so, John, lots of questions right off the bat. So, in my opinion, I don't think I use the terms health coaching and wellness coaching interchangeably. Perhaps health coaches that only focus on health might only do that, but wellness, which is where I really identify, I touch all these different aspects of life. And there are some that I don't, like I'm not a career coach, I'm not a business coach, but certainly there are areas of those things that come up in my coaching sessions.
So talk to us a little bit about how a wellness coach might help someone who's living with MS.
Yeah, wonderful question. So, you know, what one person might experience with their MS is vastly different than what someone else might experience. And so oftentimes coaching is about goals, let's say. And goals for those two individuals could look extremely different just based on their experience with MS. And so really what coaching is and what it's getting at is what fills the client's heart and soul. It's about what fulfills them. And a fulfilled life is a very valued life, and clients have their own definition of what they truly value. So coaching and values are really mixed up together. And in coaching, we're really trying to understand both of them and how they coexist.
I know there are some people who may not be as familiar with the concept of a wellness coach. What are some of the common misconceptions that people tend to have about working with a wellness coach? And how do you help them overcome that hesitation and actually try working with a coach?
Yeah, I think there can be hesitations always, certainly around change that needs to occur. So what coaching is, I think that's a good place to start. Coaching, and especially the coaching that I practice, is a very collaborative relationship between me and the individual. And coaching starts with the assertion that people are, by their very nature, creative, resourceful, and whole. And people are capable, and they're capable of finding answers and choosing to take action and learning new things, and they're capable of recovering when things do not go as planned. Coaching really helps remind people of their inner light, and it helps them find that again. It's not, when I'm coaching, I'm not sitting across from someone, from a problem that's trying to be solved. I'm sitting across from a person, and it evokes transformation. And so this is a huge, huge paradigm shift, just as the start of what coaching is and what it is not, and where it could serve someone with MS. It's not a passive process, it's work. You get in there, you get into that deep stuff with the individual. And I think sometimes people have hesitation around doing the work, right? Like, that work is hard, and it is. It's most hard, I think, by yourself. With a coach and with someone who's holding space for you, who's eliciting information from you, who's helping guide, it's a much more enjoyable process, but it's a much more fulfilling process doing it with a coach.
Just a moment ago. Oh, I'm sorry, go right ahead.
I was going to say that coaching is almost like exercising muscles that you haven't used in a while, right? Those mind muscles that are centered around change. It's really easy to just do the same thing. Even if you don't want to, it's like we just get stuck in those patterns, in those rhythms. And so coaching helps exercise different muscles, different mind muscles.
You mentioned how each person experiences MS differently, but I'm wondering if you've been able to observe any common goals among clients with MS. Are there common things that they want to accomplish with you?
Yes and no. Common things may be more around sticking to a meal plan, or sticking to a fitness or physical activity plan. But I think where I really light up in the coaching experience is getting into those deeper levels. So if someone comes to me and they have a goal-oriented, they have something goal-oriented that they want to achieve, think of that as like the branch, the leaves or the branches on a tree. And so they might come with a specific goal, but that goal, or the reason they're not achieving that goal, has so much more to do with all of these root areas, right? Root areas around purpose, around meaning, around curiosity, around non-judgment or fear, right? The roots are where we tend to go with those goals. I hope that answered.
Absolutely. I'm curious, when should someone be thinking about working with a wellness coach?
I think any day, no matter what. They can be early on in their diagnosis, or they could have been diagnosed for over 25 years. Because what I know of MS, and this is sort of how I got into this, what I know of MS is, and my experience with working with people, is that it invades and it touches all aspects of someone's life. Even if you don't realize it's there, it's definitely probably lurking around there. And I had a similar life experience of something that will never go away, and it at various times in my life has really been in the mix of everything. And there's this beautiful concept that I've worked on personally and certainly as a coach of what it means to lean into something and what it means to lean out, lean away, right? So leaning into our life experience, while it's a harder direction, there's less like inclination to lean in, it's so fruitful. That's where all the change happens versus leaning away and leaning out of the experience. So as a coach, part of what I'm facilitating and I'm encouraging is that lean in. What's the leaned in experience of having MS?
Amanda wrote in to ask if working with a wellness coach replaces the need to work with a neurologist to manage MS. Kate, what do you have to say to Amanda?
Amanda, wonderful question. Coaching does not replace any practitioner that you have. A coach joins the team. They're now on your team, your global team of healthcare practitioners. Coaching is not a replacement for medical advice. There should be no, really one of the core values of coaching is it's non-prescriptive. So there should be no, as the coach, I'm not telling someone what to do. I'm curious about why it is they're doing what they're doing, what it means when they're doing what they're doing. And so coaching does not replace practitioners. It is not a replacement for therapy. Coaching's paradigm is very much present and future focused. Therapy is a very past, present, future. So things certainly will come up in a coaching session around past events or trauma or what have you. My angle with that is, how does it fit in the present moment? How does it impact that person moving forward?
Well, thanks, Kate, for sharing some insights about what wellness coaching is and how it can help. Before we talk about what people should expect from a wellness coach and how they can achieve the very best outcomes, I want to take just a quick moment to welcome those of you who have continued to join us on GoToWebinar, Facebook Live, and YouTube Live. Please let us know what's on your mind. Post your comments and questions on Facebook and YouTube, or type them into the questions box if you joined on GoToWebinar. Our Ask an MS Expert live event takes place at this same time every Friday. So please help us make sure that everyone knows about it by sharing news about the webcast with your family and your friends. We've been talking with wellness coach Kate Costello, and now I'd like to look at what to expect from wellness coaching, the importance of establishing a positive client-coach relationship, and how clear goal setting can create better outcomes. Kate, let's talk about what makes a good wellness coach-client relationship. What should people expect from their experience with a wellness coach?
Yeah, so I think a few things that make a favorable experience. I think the coach that you seek out needs to have proper training. They're professional and they're someone that is committed to their own growth, but also the growth of their clients. It's important on both ends, the coach and the client, to be naturally or to cultivate curiosity, to look for opportunities and possibilities.
Well, looking at the other side of that same question, what are some unrealistic expectations of working with a wellness coach?
I think unrealistic expectations are that they replace another practitioner or healthcare provider. And also, coaches are not here to fix you, right? Intrinsic in coaching is that the person is whole and resourceful. And so they need no fixing. At least this is the type of coaching that I practice. You can have goals, but it's not because you are broken and you need fixing. Which is, I think, a really big paradigm shift.
You're right. You're right. I'm wondering, how does someone go about finding a wellness coach?
Oh, well, you can go to wildcraftedwellness.net, and that's my website. And I'm just kidding. I think it's important to look for credentials and certifications and degrees. There is not a ton of accreditation in the coaching world. There's a few big accrediting bodies. One of them is ICF, the International Coaching Federation. And on their website, they have a database that you can search for a coach. And coaches that have gone through ICF training, myself included, in my master's program, I have a master's in health and wellness coaching. When you go through that, there's rigorous requirements for that. There's a certain amount of hours. So it's a true program. It's a true accreditation. So I think it's important to look for someone that has experience and that has had some really good training.
What are some of the red flags to be on the lookout for that might indicate someone is not as qualified as they may claim?
Mm-hmm. You know, I think the wellness world can be notorious for very well-intentioned practitioners that can work outside of their scope of practice. I have a really unique situation where I have a master's in nutrition and I have a master's in health and wellness coaching. And so I can trade off my hats in those two different scenarios. Oftentimes, if I see someone that's a nutrition client, I might utilize some of my health coaching in that experience because I'm being prescriptive and I need them. There's some change that we're working on that I am driving, right, as the nutritionist. In the coaching world, or my coaching hat, I really have no business prescribing any sort of information. And so I think it's important that practitioners stay within their scope of practice and that coaches also respect, or coachees, the individual respects the scope of practice, right? I think it's outside of the realm of appropriate to have your coach be your only practitioner, right? There has to be a team of practitioners because the coach is really there, like next to you, holding your hand or like arm around you, you know, like we can do this, you've got this, you know, it's that motivation. And you have those other practitioners that are there for guidance or their references for, or their wells of information for your health outcomes or for your health status.
Are there any specific questions that people should ask to determine if they found the right coach?
Yes. I think finding a coach is like finding a therapist or finding a partner, right? There's a bit of dating that occurs because so much of the coaching relationship, so much of, I think, the medicine or the therapy of coaching, right? Like that, the juicy stuff is in the relationship you have with the coach. So you've got to like them. And I would say too, if they rub you a little wrong or rough, that might be something, you know, there might be something really in there, and that might be a really good coach for you. Somebody that's gonna, you know, hold space, but like, you know, make it so that there's forward motion or at least motion in some direction. I think also finances are a huge consideration. And so making sure that you are working with someone that fits within what you can afford. Coaching is not totally covered by insurance. I've only had one client ever that was able to use insurance for the coaching that we did, and there was a government insurance. And so if it's a requirement for you that there is some sort of insurance coverage or there is a sliding scale to meet your financial needs, then that's also something I would ask of a coach. often coaches offer, myself included, a somewhere between 10, 15, 20-minute intro call. And in that is when you can get a lot of those kind of questions answered. It's like speed dating almost, that 20-minute call.
Well, you mentioned affordability, so I'm curious, on the average, what can people expect coaching to cost?
Yeah, I think there's a huge range. I've seen numbers somewhere on the lower end of like 50, 75, and then way up from there. I know executive coaching, for instance, is one of the most expensive things to do. So it's such a range. And like I mentioned, insurance is dodgy at best. And, we don't need to get into the broken pieces of our healthcare system, but, there's not currently a lot of space in it for wellness. Now, coaching is this amazing, like up and coming thing in the insurance-based world, because coaching can help with medication adherence or protocol adherence or coming back for your follow-up appointments. Coaches can be this wonderful bridge between the patient in that model and the physician. And they can help troubleshoot, right? Like a doctor, you see them for 5 minutes, they send you home with a list of things to do or not do, and then what? And that's where coaching comes in. Coaching helps you define, decide, and do the and what. And what do you do with this information now? So there is some change happening in the insurance world of utilizing health coaches in private practice, in insurance-based practices. So the tides are changing, which is really amazing, which means this will become increasingly more accessible to people.
How long is a coaching session, and on average, how many sessions will someone need?
So great question. So somewhere between 30 minutes and beyond. I've been a coachee with a coach, and we used to coach for 2 hours at a time, which was just incredible. I mean, you get all the way down into the juicy stuff. My typical sessions are 50 minutes, and I see people for 3 months, every week for 3 months. And I am currently working on creating a program for a year. So some version of weekly and group coaching sessions for an entire year. Because coaching, it's so much about like showing up for yourself, building in the accountability of each week at 10 a.m. on Tuesday, I work with my coach and we unpack all of the stuff that I'm in need of unpacking or defining goals around, or, goals are an interesting thing. If they're really big, people tend to not do them, right? And so it's really useful to work with a coach to help chunk them down and pare them down so that there are manageable, buildable steps and outcomes to what you're trying to achieve. So I think each coach, it's maybe another vetting question. Each coach might have their own process. My process is 50 minutes, 3 months, and certainly I'm flexible. And it's a dynamic process as is life. And so I have space for all of that, but I think consistency is key.
During the pandemic, we're going through a time where we don't do very much face-to-face in person. But I am curious, in more regular times, is coaching something that happens in person? Is it over the phone? Is it a Zoom session? How do you coach?
All of the above. Yeah, pre-pandemic, all of the above. Some of the most interesting coaching for me on the coach side of things occurs over the phone. And I think that that's a few reasons. It really allows the individual to be really in their element, right? Like in their safe space. And there's so much that happens with eye contact, and you read, you pick up on so much, but even more so on the phone when there's that barrier that you can't actually see someone's face, but you're hearing other pieces. You're hearing breath or intonation in words that you otherwise maybe might miss with just looking at their face in person or through Zoom. So I'm flexible. I see people in all of the ways. Currently, right now, only virtually through Zoom, or I have a secure platform, and or by phone.
In the article that appeared in last month's Momentum magazine, I remember that one of your clients, Lauren, shared the personal success that she experienced working with you. What sort of outcomes did Lauren experience, and why was she so successful in achieving her goals?
Well, we talked about this a little bit off air, but Lauren is a very coachable person. She's a longtime figure skater, and so she has always had a coach. And not that that's a requirement by any means, but Lauren really needed to find her voice in her MS experience. For her, it felt like it was just dumped on top of her, and it was hard to catch her breath. It was hard to find her voice. It was hard to find her footing in it. And so a lot of what we did together was tons and tons of reframing. What did it mean? What's the opportunity in all of the uncertainty that she that was put on top of her, or she felt like it was put on top of her? And she had a new diagnosis, and she was really unsure of what to do. And I didn't tell her what to do. Lauren knew what to do. She knew how to take the next step. I think what I did for her and what was so successful was that I allowed her to really live to lean in, right? That lean in of her new diagnosis. So for Lauren, it was not about any sort of like meal plan goal or sticking to a meal plan or physical activity, nothing like that. It was more of how could she frame this diagnosis.
During our conversation, I think the word that keeps popping up is goals. So how do you approach setting goals with your clients so that they can experience some of the same kind of success that Lauren experienced?
Like I mentioned, goals are so individualized, and they really are an expression of what an individual's true values are. And so, there's lots of different ways that you can set goals. There's SMART goals, there's specific, measurable, attainable, realistic, and timely. Those are ways to, if somebody has a goal that they want to walk 5 miles, well, we break that all the way down into a SMART goal, and that helps with accountability. I think if coaching was only driven by goals, someone might feel the need to have a coach with them lifelong. But coaching, like I've mentioned a few times, is about fulfillment and potential. And what someone learns from connecting goals with potential, with their potential, it can naturally be applied to other life circumstances, right? So if I have a goal, but I don't feel like I can achieve that goal for a whole list of reasons, and in coaching, I start to see like, oh, I can start to get to the bottom parts of this goal, and I'm starting to notice like my potential here. That's the transformation, right? That's the magic. In coaching, we call it the aha moment, right?
Right.
Coaching is a process. It's a long game. And I'll throw this out there, and it may just be a personal musing or it might resonate, but goals are not the only way to measure success or wellness or growth or fulfillment. Goals and outcomes are concepts that we love in our world to promote, right? Follow this meal plan, lose this much weight in this many weeks, or this fast track training program to abs of steel, right? They're so measured. And I think it can often, like a goal, it's just a carrot and we dangle it. And as soon as we get close to it, it moves. Or there's a shinier carrot over here. And so I think that there are other ways in the experience of working with a coach to measure whatever success is. Like perhaps we define what success really looks like or means.
When I first mentioned your client, Lauren, one of the first ways you described her is you said she was coachable. I'm wondering if there are any specific things that you see people doing that allows them to be more successful in moving forward or achieving positive outcomes and working with you.
Yeah, most people come to me or get to me when they are just at the end of like they need change to happen, right? It's imperative because it's not working. I don't typically work with people because they're not seeking me. If they're not after some level of change, or if they're not sure they need to or want to change, they're curious about it. And I think that curiosity, that willingness to see something differently, is key to coachability. So that's kind of what I'm in that 20-minute call. That's what I'm looking for, are hints or clues to at least a little opening. All I need is a tiny little opening.
What are some of the toughest obstacles that people need to overcome in order to see success working with you?
I think themselves and fear and disconnection or not having some sort of like social network or support system. I think self-judgment, lack of confidence, and that's all that we work on in coaching. That's it. That's where I am in a very present and future focus.
Well, thank you for sharing your expertise. Now I'd like to focus our time on addressing some of the questions that our audience has for you. Clearly, we're in very different times in the midst of the current pandemic with constant news and commentary coming at us that can be a little jarring. Jane writes in to say that she's feeling anxious. She worries about herself, her kids, and her elderly parents. Jane isn't sleeping well, and her diet is suffering because there's a lot of junk food around. She's feeling isolated at the same time. What kind of advice can you provide to others who are experiencing issues just like Jane?
Jane, thank you so much for your question. And, I'd like to really validate that all of what's happening is scary, and there's so much uncertainty. And one of the things that Jane is saying that stands out most to me is feeling isolated. And, studies have shown that social isolation is as detrimental to health as smoking or obesity or lack of physical activity. And I think the pandemic has really highlighted and certainly challenged our basic human need of connection. We're pack animals. Humans are pack animals. And so, Jane, I would first start to explore around this idea of isolation and worry, right? Like get it all out on the table. What are all the worries? And in coaching, one thing that we do when there's a lot of plates on the table is we focus, right? So you lay them all out and then we focus, like which one feels like the biggest thing to dive into today? Which one can we look at just today? We can talk about the other ones, but today. And I have a brilliant yoga instructor. Her name is Catherine Zach, and she was just recently talking about reframing all of the uncertainty that we have in this pandemic as possibility. What's like the, in yoga, there's a pose and then there's a counter pose. And I think in life you have the same thing, right? Like there's uncertainty, but what's the possibility? What's over here that maybe we're not seeing because we're just so focused on the uncertainty? And again, not just validating that there isn't a ton of it, there is oceans of it right now. And where is one area that there might be that little opening, there might be that little bit of possibility?
Carol says that her exercise plan really helps her with strength and flexibility. And no matter how much she tries, she can't stay on it. She even writes that it seems ridiculous not to be able to stick with something that you know works. What kind of advice can you provide in that situation?
Carol, I hear you. And it is hard to stick with a plan, especially without any sort of context to what it is. Like I hear that it feels so good and it improves your strength and flexibility. But what is it about physical activity, this exercise plan, that you're after? What else is it? What else is under there? And it's defining that why behind the exercise plan. Because when we define that why can be an anchor to the exercise plan. So when if your goal is to exercise when you get home from work, and you're totally tired and flatlined when you get home from work, and laying on the couch seems like such a better idea. When the why is not there, you're getting on that couch for sure. And then the exercise plan is up in the air. But when the why is defined, it anchors us. So when you get home, you go right to your, at-home workout or whatever it is that you're doing. So with Carol, I might try to understand more of what the exercise plan is, what it provides her, other than great strength and flexibility, which is beautiful. And where is it? Is it in a part of her day that she has a lot of energy and gusto to work out? Or is it at a time of day that she's flatlined with energy? Where does it fit?
Well, John wants to know, if he chooses to see a health coach, how can he best prepare for a session so that he gets the most out of it?
So in my practice, the first coaching session, I do this exercise called the wellness wheel. And it's a wheel and it has various different dimensions of wellness, like career, finances, spirituality, food, exercise, all of them. And we go around that wheel a few times to get a pulse on where these different dimensions are. Where is there balance? Where is there no balance? And what's priority? So I sort of build from that activity. We kind of map out what happens the next few weeks. But even beyond that, I might have some sort of loose roadmap, but coaching is so dynamic, which is part of the reason it works so well, that we could go totally rogue from the plan that we mapped out. And there's still so much change that occurs. Oftentimes I have clients like John who prepare and then they get to the session and they just got an email from somebody at work and it just throws them. And that's then what we coach on. It's very dynamic and it can change. I think, John, if you were new and you were seeking a health coach, you might take a little self-inventory of where the sticky areas of your life are, or where, like, what's stuck, where are you confused, what are you challenged by? And maybe in the vetting process of finding a coach, you float some of those things, like, hey, these are the things that I'm after. Is this part of your toolbox? When I'm with clients after that first session, you know, the next subsequent sessions, we hello, how are you? And then I will bring up the topic that we planned for, or I will float if there is something else that they are bringing with them to the session today. So it's dynamic, we can follow it.
Well, speaking of dynamic, while you and I have been talking, Julie Feel has been in the background fielding questions in real time. And Julie, I'm sure you've collected a few for us today.
We have a lot of questions for you, Kate. People are really enjoying this talk. I wanted to start with some of the questions we're getting in. I can tell that there are some of our viewers who are still trying to wrap their heads around what is a health coach? What is a wellness coach? How is it different from a therapist? I'm hearing someone, Lisa, is asking, how is wellness coaching, or she's asking, is it the same as integrative medicine? I think she wrote that in when she heard you talking about how the coach is now part of your team. And Cheryl is asking, could a wellness coach be a good choice if she needs assistance in regulating her life to relieve migraines and improve balance in her life? So maybe could you, before addressing those specific questions, maybe reiterate what is a health or wellness coach able to do for you?
A health or wellness coach is a change agent. They are helping to facilitate change in your life, whatever change that you are after. Like I said, it's a collaborative experience. A coach is on your same level. When you see your neurologist, they are the expert, right? They are your expert. When you see a therapist, they're from an expert point of view. Coaching is right with you. I'm not a friend. I'm not your cousin, but I am someone that's on your same level, that's with you, that's there for you, that's there to support you, that's there to help you get the change and outcomes that you're after in your life. I don't define, as your coach, those changes. You get to define those. And then we together explore how you can change, what needs to occur to achieve those goals.
So back to Lisa's question. A few weeks ago, we had a neurologist on with us talking about integrative medicine. I know you're very well versed in integrative medicine. So how does wellness coaching relate to this concept of integrative medicine?
I'm not going to say I know the definition of integrative medicine, but how I interpret that is, there are a lot of pieces to someone's health puzzle, many, many pieces. And it takes a team to really understand what's going on, to help actualize change, to help heal in whatever spectrum that occurs. And a health coach is part of that. Imagine a health coach like you go to your doctor's appointment and, there's 15 minutes in that. And a health coach might help you prepare for that appointment. Like, doc, these are the most important things that are going on for me right now. These are the things that are coming up that I need support and navigation with. Can you help me, right? They're resourcing you so that when you're in front of the doc or you're taking charge of your life, you know what to do. You have a plan of what to do. And so integrative medicine is a concept of a whole approach, right? It's trying to get the whole approach. Conventional medicine likes to piece the body, piece the person into all these different various parts. And integrative is just what it says. It integrates them all back together, puts you beautiful human, back to one piece. Not your various parts, but all one.
Yeah.
That's how I think of integrative medicine. And I think a coach can be a very useful part of that team.
Well, I think almost all, if not all of our viewers can relate to needing some extra help with making the most of their time with their MS healthcare provider. Those are sometimes very fast appointments, so a coach could be helpful with that. So what advice would you give to Cheryl, who's asking if a wellness coach could help in regulating her life and relieving her migraines and helping her find balance? Is that something a wellness coach can help with?
Yes. So regulating your life. There's so many questions, I think, Carol, about what that means and where you feel like things are dysregulated. And so, yes, I think a coach can be quite useful for that. If a coach starts telling you what to take for your migraines, I think they're way outside of their scope of practice. But what a coach might explore with you around your migraines is, when do they occur? So I have this brilliant teacher in grad school talk about symptoms as teachers, which is, again, such a shift. And so if you think about, Carol, your migraine as a teacher, what a coach could help you do is figure out how do you get to a migraine? What occurs that provokes or brings on a migraine? Are there other wellness steps in front of that maybe need some support or change so you don't have migraines, right? Like, Carol, if you're not getting enough rest, what's going on with rest? Where do you need more rest in your life? Because rest prevents a migraine for her. Just making that up. Does that land?
That does make sense. I know you talked with John about setting goals, but Helen wrote in a question about goal setting as well, just asking, how do you set reasonable goals for MS patients who could face different challenges each day? So I think she's getting at, MS changes day to day. How are you supposed to set goals for something that changes so quickly and so often?
Yeah, I think that is a few things. Seeing a coach regularly is a really great way to be flexible in those goals. Goals are not your to-do list, right? We're trying to get away from the to-do list. Wellness is the antidote to the to-do list, right? And yeah, so what do I want to say? I think that I'm a little lost, Julie. Will you remind me what her question is?
She was talking about setting goals with things are changing so frequently.
So there's got to be some way to hold goals, which can sometimes feel a bit rigid, with flexibility, right? So if the goal is to wake up every day at 7 a.m., and you wake up at 7:15, you wake up at 6:05, you wake up at 7:45, right? Of those days that you didn't wake up at 7, what else was going on? Are there other areas of this goal that need a little more support or a little more flexibility? So I think that goal setting, again, super individual. I mentioned before, SMART goals: specific, measurable, attainable, realistic, and timely. That's how goals get achieved. You got to chunk them all the way down.
That's great. Well, there's a lot of interest in you also being a nutritionist. So there's some questions about nutrition. We even had a question about, I'm trying to find it so I can get the name right, but somebody was saying, is a wellness coach also able to focus on nutrition, or is that just you because you happen to have both of those skill sets and those certifications, or can everyone expect their wellness coach to be able to focus on nutrition?
I don't think all wellness coaches should be focusing on nutrition. And I want to be quite clear. When I wear my wellness coach hat, I really wear that hat. I am not prescriptive when I'm in my wellness coaching mode. When I'm a nutritionist, I am very prescriptive. We are achieving these goals that I set as the practitioner. In coaching, the client sets the goals. I think in terms of coaching and nutrition, again, well-intentioned practitioners can work outside of their scope of practice. remember that coaching is really about change. And so if you have a nutritionist and they gave you a meal plan and you're not following that meal plan, that's where the coach comes in, right? If you're not following the protocol, whatever it is, whether it was set by you or someone else, that's where you coach, right? It's about the change. It's about putting that into your life, making that work in your life.
Well, that's great. Paige wrote in to say that it's really hard for her to do workouts because of the physical pain that she experiences. So she's wondering, would it be best for her to focus on her eating habits?
Yeah, Paige, great question. I think that that's a wonderful thing to navigate with a coach, right? Like, what's most important here? And do they interact together? You know, like the stronger, the more nutrient dense your diet is, does that help with the pain that you experience, right? Nutrients, they can be very anti-inflammatory. Foods are anti-inflammatory, or they can be quite pro-inflammatory. And so is the diet that you're trying to stick to, is it contributing to any of your pain?
So it's interesting that you mentioned anti-inflammatory foods, because we had some questions about that. We had somebody who's watching us on social media write in and say, are there specific foods to reduce inflammation and encourage the repair of myelin? And then Maria was also asking something similar. Are there foods that can worsen MS? So are there foods that can be helpful and reduce inflammation? And maybe if you could speak to repairing myelin. And then the third part of that is, are there foods that can make things worse?
Yeah, great question. So here's your little nutrition lesson for today. Is, you know, the body is only composed, this is very reductionistic, I recognize, but the body is made of nutrients, only nutrients. And if there's someone out there that has another non-nutrient that the body's made of, let me know, because I haven't found it yet. And so the little trivia question I like to ask is, what are those nutrients? There's 6 of them. And so proteins, fats, carbs, vitamins, minerals, water. Those are all 6. That's your entire amazing, brilliant, vast body is made up of all of those nutrients. And so in terms of things that are pro-inflammatory or anti-inflammatory, well, things that contain those nutrients are inherently anti-inflammatory, right? Whole, real food from the earth is naturally anti-inflammatory. Foods that come in bags, boxes, containers, the freezer that's not frozen intentionally, like whole food, you know, like a piece of steak or something, things that come in packages can be more pro-inflammatory. And so take a little inventory of your diet. Does the majority of your food come from the earth, or does it come from bags and boxes? And what's your inflammation levels like? Now, nutrition is complicated, and you can really get into the weeds of it. And there are many whole foods that people react to. You know, someone might have a food allergy or sensitivity to salmon or turmeric or something, right? Those are 2 very anti-inflammatory foods. Versus someone else who might do just fine with those, and those are quite helpful for their inflammation. So I think that just a zoomed out perspective, foods that come from the earth are anti-inflammatory, foods that come from factories are pro-inflammatory. And if the body's made up of those 6 nutrients, proteins, fats, carbs, vitamins, minerals, and water, do you have those nutrients on your plate when you eat breakfast, lunch, and dinner, right? And the more balance you have of those 6 nutrients, the less inflamed the body is, right? Because those nutrients are what our bodies are made of.
Well, that was a great way to simplify a very complicated question. So thank you so much, Kate. I'm going to turn things back over to John, because that's all the time we have for questions.
Thank
Well,
you.
thanks, Julie. And let me thank all of you who submitted your questions. And thank you again, Kate Costello, for joining us today.
Thank you, John, so much. And thank you, everyone.
I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information you're getting is credible and reliable. So we'd like to share some resources with you. And these are resources that you can count on to be credible. I want to remind you that if we were unable to get to your question today, please know that the National MS Society's MS Navigator team is available to answer your specific questions and connect you with the very best resources. I'll share all the ways that you can connect with an MS Navigator in just a moment. I'd also like to acknowledge that we're in the midst of an emotionally difficult time for so many people. And I want to make sure that you're aware that the National Suicide Prevention Lifeline is available 24/7. They offer free and confidential support for people in distress, as well as suicide prevention and crisis resources for you or your loved ones. You can reach them by calling 800-273-TALK. That's 273-8255. If you'd like to connect with Kate Costello, you can visit Wildcrafted Wellness at wildcraftedwellness.net. And another resource for you to check out is a new partner to the National MS Society, PAC Health. PAC Health is offering a free initial one-on-one coaching session and personalized resources to help people better manage MS. If you want to find out more, you can visit pachealth.com/COVID-19. I'll also remind you that every week on the Real Talk MS podcast, I continue the conversation that we start here. So I hope you take a few minutes and give Real Talk MS a listen. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Pandora, or wherever you find your favorite podcasts. And we're all witnessing that even during a pandemic, MS doesn't stop, and neither does the National MS Society. This webcast is just one example of how the MS Society has created virtual programming on the fly so that no one has to face MS alone. They've also created virtual support groups, provided resources and information about COVID-19 so that people affected by MS can get answers to their questions, and healthcare providers can deliver the very best care to their patients. The Society continues to amplify the voices of the MS movement to influence critical public policy decisions, and they never stop advancing the research that will find a cure. The National MS Society COVID-19 Response Fund has been established to ensure that the Society can meet the urgent and expanding needs of the MS community during these unprecedented times. And I'm asking you, as you're able, to support the MS Society's work by making a donation to the COVID-19 Response Fund. To donate, just text the word GIVE to 68686, and you'll get a link right to the MS Society's COVID-19 Response Fund webpage. I hope you'll contribute today. It's never been more important. Now, I promised that we'd share all the ways for you to connect with an MS Navigator. You can find them on the MS Society's website at nationalmssociety.org. You can contact an MS Navigator by phone at 1-800-344-4867, or you can email an MS Navigator at contactusnmss@nmss.org. You can also connect with the MS Society on your favorite social media channels, including Facebook, Instagram, Twitter, YouTube, and LinkedIn. And when you do, please make sure to like those social posts and subscribe to those channels. And you want to make sure that you get on the Society's mailing list by signing up at their website. That way you'll receive regular updates on upcoming programs and the latest information on MS treatments, research, and how to live the very best life with multiple sclerosis. I'd like to thank Kate Costello for joining us today, and I'd like to thank everyone who's joined us for your really great questions and engagement. Please remember that a recording of this webinar is going to be available for your review on the Society's website at nationalmssociety.org/MSexpert. And now I have a quick favor to ask of you. Your feedback is really important, so you'll see a survey pop up in a moment when we close out the webcast. And if you're watching on Facebook Live or YouTube Live, you'll see that survey pinned to the comments section. Completing the survey makes a real difference. The information you provide helps us improve future programs, and so take just 1 minute and please fill out the survey today. On behalf of Kate Costello and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.